said pressure from patients was a major factor. So do people's expectations need to change? Well, let's discuss this with Dr. David Warriner from the Academy. Morning to you.
Morning.
Thank you very much for coming on. Is this about saving cash?
No. It's about having good conversation with patients and giving patients the tools they need to help doctors make the best decisions for them, really.
There's a whole list of treatments. I mean, let's just look at some of them. For example, tap water is just as good for cleaning cuts and grazes as saline solution. Really?
Yeah. So Cochrane review, Cochrane are the sort of world's biggest organisation for looking at data in medicine, and they found that tap water is just as safe and as effective as sterile saline solution from a bag.
I mean, and how much difference in price is that?
Well, very expensive.
So a saline bag costs you a lot of money?
Yeah, that's right.
Is a lot of this about the way that we talk to doctors, and that, some of it seems to be the doctors almost thinking, well, patient expectation is this, so I'm going to try and help them by giving them that, when actually a conversation and talking things through would actually probably save a bit of money, even though it might take a bit longer.
I think you're absolutely right. I think that the problem is doctors are trained to do things, we're trained to do procedures and carry out tests. Patients often come into the practice or the clinic with the expectation that they'll receive something, medication, referral or a scan. So I think it's sort of bringing that back and having the conversation. Actually, it isn't about that. It's about the conversation that what do you actually want, really, and minimising the harms to patients from treatments that aren't effective, I think.
So what sort of questions should patients be? I mean, obviously it's down to doctors to bring up have these conversations, but also from patients' point of view, what sort of questions should you ask then if they're offering you a treatment? Is it going to work, for example? Or how much difference is it going to make? Yeah,
exactly. So the Choosing Wisely initiative come up with 5 key questions. So, do I really need this treatment? What are the risks of causing harm to myself? What are the side effects from the treatment? What happens if I do nothing? So if I just do nothing at all, will I still be okay? And are there any alternatives, so less harmful alternatives?
And one of the key things is, for example, back pain, because I mean it's a thing that affects so many people, and you've got a recommendation about X-rays, haven't you?
Yeah, that's right. So back pain that's not brought on by trauma, such as a car accident, is generally due to wear and tear in the nerves or the joints. The X-rays just don't show up really. So you need an MRI scan that actually. X-rays can cause radiation. They have radiation. They can cause harm from cancers, etc. So it's better to have a MRI scan if that's needed. But obviously that's in certain cases.
Right.
One of the treatments on the list was the use of chemotherapy for terminally ill patients.
Right.
Explain the thinking behind that, if you can.
Okay. So the terms we use are in advanced cancer, the use of palliative chemotherapy should be minimised where the risks of harm are great and risks of benefit are small. So obviously chemotherapy can have side effects, it can lead to infections, it can lead to suppression of the bone marrow, etc. So we're really saying that if we think we're going to cause you harm, then we'd rather we don't do it, which I think that's what doctors always do. First do no harm, that's why we're in medicine. We're not here to hurt patients, we're there to make them better. So we think the risk of making them worse is high, then we wouldn't offer it.
Okay, so do you think the sort of nature of the conversations we're having with doctors needs to change then in some ways?
Yeah, I think so. And I think the Choosing Wisely initiative really is trying to empower patients to have that discussion. We're not saying we will never do this or always do that. We're just saying have the conversation in the first instance and try and better understand what the patient expectations are.
It's hard to do that when there's sometimes not much time when you're going to see a GP.
Yeah, that's right. So and making GP appointments 50 minutes to having with longer time to have in the discussions would be helpful, I think.
Okay, Dr. David Warriner, thank you.
Thank you.